Welcome to The Explainer. Today, we're going to peek inside the operating room to see how surgeons are using some pretty amazing tech to fix a super common problem, the ventral hernia.
All right, so let's just quickly get on the same page. When we say ventral or incisional hernia, we're talking about that bulge that can pop up at a weak spot in your abdominal wall, almost always right where a surgeon made a cut in a previous operation.
And believe it or not, this is an incredibly common thing. These hernias can show up months or even years after surgery. And when they do, they usually need another procedure to get them fixed.
But here's where the story gets really good. The way we fix these things has been completely transformed. We've moved on from those big open surgeries to methods that are just incredibly advanced and minimally invasive. So let's get into our first section. This whole new way of thinking is really all about less is more, using tiny little incisions to pull off what's actually a major repair.
Yeah, the whole goal here is to steer clear of making another big cut. Instead, the surgeon makes just a few tiny entry points. We call them ports. And those little ports are the gateways for all the tools they need to fix everything from the inside.
Okay, so this brings us to two really cool high-tech ways to do this. You've got the laparoscopic approach, where the surgeon is directly holding and moving the instruments. And then you have robotic surgery, where the surgeon sits at a console and controls these super precise robotic arms. The end goal's the same, but it's how the surgeon controls the tools that's different. So what actually happens in the OR? What does the surgeon see? Let's walk through the key moments of the procedure itself.
Okay, so first things first, they need to create some room to work. They gently inflate the abdomen with CO2 gas. It's kind of like blowing up a balloon. This lifts the abdominal wall up and away from the organs, creating this safe dome-like workspace. Then they place the trocars, which are the little tubes for the camera and tools. After that, the surgeon carefully pushes that herniated tissue back where it belongs and stitches the hole shut. And finally, in comes the mesh to reinforce everything. And that is the critical final touch.
Now, that last step we mentioned, the mesh, that is absolutely crucial. So let's talk about why this little piece of material is the real key to a strong, lasting repair.
Right? So think of this mesh less like a simple patch and more like a permanent scaffold. What happens is your own body's tissue actually grows into and around it, creating this newly reinforced wall that's way stronger and much less likely to cause problems down the road.
And to make sure this reinforcement really works, the mesh is always cut to be bigger than the hole. We're talking an overlap of at least 5 centimeters on every single side. And you might be thinking, whoa, why so much extra material? It seems like a lot, right? Why does it need to be so much bigger than the hole it's covering? Well, this is where the surgical planning gets really clever. See, surgeons know that this mesh material, it naturally shrinks just a little bit over time. So by planning for that big 5-centimeter overlap from the get-go, they make sure that even after it contracts, that original weak spot is still completely covered and protected. It's a brilliant way to lower the chances of the hernia ever coming back. And sticking that mesh in place, that's a whole science in itself. There isn't just one way to do it. Surgeons have a whole toolkit, things like absorbable stitches, little tacks, and in some cases, even bone anchors or surgical glue. The choice really depends on exactly where the hernia is and the patient's specific anatomy.
All right, so the high-tech surgery is done. What happens next? Let's talk about recovery, which honestly is often just as streamlined as the operation itself. Okay, post-op instruction number 1, and it's a big one. Just avoid straining. Seriously. No heavy lifting, no intense exercise. The whole idea is to let that internal repair heal up without putting any unnecessary pressure on it.
And this is one of the huge pluses of going with a minimally invasive approach. The recovery is fast. I mean, most patients get to go home the very same day. And within about 2 to 4 weeks, most people are back to their normal daily routines.
And here's a really important reason why that recovery is so smooth. The procedure is classified as Class 1 clean. Now, what that means in simple terms is that the surgery is done in a totally sterile way. And since they aren't going into an infected part of the body, the risk of getting an infection afterward is super low. So when you think about it, going from a big open incision to just a few tiny ports, it's just an amazing example of how technology is making surgery safer, stronger, and way easier on the patient. It really makes you wonder, doesn't it?
What other common medical problem is going to be the next to get a full robotic upgrade? Thanks for joining us for this explainer.